Hello, today I'll be discussing the issue of unequal access to maternity healthcare in the United States and presenting my proposal to improve healthcare accessibility and diversity for underserved communities. This issue is important because many pregnant individuals, especially low income families and women of color, struggle to access safe and quality prenatal and postpartum care. This issue matters because access to maternity health care can demonstrate whether a pregnancy is healthy and safe. Without regular prenatal care, conditions like high blood pressure, infections, or gestational diabetes may go untreated. The CDC reported that maternity mortality rate in the United States was 17.9 deaths per 100,000 live births in 2024. Many experts believe that a large number of those deaths are predictable with earlier and more accessible care. The groups most affected by this issue are low income families, rural communities, and minority populations, especially Black women. Many pregnant individuals have to travel long distances just to receive prenatal care. Dr. Alma Williams from March of the Dimes stated that the ability to have a healthy pregnancy depends on where they live. The quote highlights how healthcare access is deeply connected to geographic and economic inequality. There are several factors that contribute to this issue. Many hospitals, especially in rural areas, have closed their maternity units because of financial challenges and provider shortages. Transportation and insurance barriers also make it difficult for patients to attend appointments. According to the March of the Dimes, over 35% of countries in the United States are considered maternity care deserts, meaning that they lack hospitals with obstetric care and maternity providers. The March of the Dimes reported that more than 2.4 million women of reproductive age live in maternity care deserts. In 2022, over 150,000 births occurred in these areas. Research just show that women living in these conditions receive less prenatal care and experience higher rates of preterm birth and pregnancy complications. Therefore, my proposal is called the Community Maternal Access Initiative. This program would focus on increasing healthcare accessibility and improving diversity within maternity healthcare. The program would expand telehealth services for prenatal care, provide transportation assistance for appointments, recruit more diverse healthcare professionals, and increase the use of doulas and midwives in the underserved communities. It would also require cultural complicity training for healthcare workers. My proposal would work because it directly addresses many of the barriers that prevent patients from receiving care. Telehealth can help rural patients connect with providers without traveling long distances. Diverse healthcare providers and doulas would help patients feel more understood, supported, and respected. One healthcare expert stated, "We know what to do, we just need to apply it." This shows that many solutions already exist, but stronger action and funding are needed. This proposal would require cooperation between hospitals, public health departments, medical schools, community organizations. Funding could come from the state and federal public health programs. Resources needed would include telehealth technology, transportation partnerships, healthcare training programs, and community outreach workers who can connect families and are available for services. The expected outcomes of this proposal would include lower maternal mortality rates, improved infant health, increased access to prenatal care. I would also expect stronger trust between patients and healthcare providers. The success of this proposal would be measured using maternal mortality statistics, patient satisfaction surveys, and prenatal visiting attendance rates, also along with infant health outcomes. Why I chose this topic? I chose this topic because maternal care inequally affects millions of families in the United States, and I believe that healthcare should be accessible for everyone regardless of their race, income, or location. While researching this topic, I learned how social and economic barriers can seriously affect health care outcomes for mothers and babies. This issue is important because many of these complications and deaths are preventable with better access to care. These are the main sources I use for my project. They include information from the CDC and the March of Dimes, which are both credible organizations focused on public health and maternal health care. Thank you for watching.